around and get.
Go ahead. I got to sing a song. Hello out there. Good morning. This is Bob, Brad, and Mike. We are here for our live podcast, broadcast, whatever it may be, but we are talking about arthritic joints and how to make them more functional, moving without pain, making your life better. Wow, I memorized that, started it last night, and I got through it without any issues. So we are happy to be here. It's a beautiful, warm morning in Minnesota. Let us know your name and your location where you live if you would like to on the comments. We'll go through them and wave or whatever. We're going to holler out a good hello, hello. Good morning, morning. Hello, sunshine. Giddy up, sleepy head. I love waking up next to me as much as I love waking up next to me. Well, anyways, we got some people move, Mike. I can't see. Emily, good morning.
Am I on now?
Good morning.
Hello.
Kimberly. I like the way you spell that name. Yes.
I figure I better join because Brad
L-E-I-E
just
at the
keeps
end.
randomly singing stuff.
Yeah, I'm
He's out of
warming up
key, I
my
think.
voice. I'm going to Nashville. Anyways, Patty from Utah.
They
Hello,
all
Patty.
They all sing with
Like
southern
that.
twangs there
Jill.
anyway. It's fine.
Mary Day, Florida. What's the weather like in Florida? Oh, can they
Feels
see
like
me?
Florida here. It's humid. No, they can't see us yet.
It's nice and warm and humid. I've got my orange shirt on. I thought I'd do something new.
Did you even tell them what we're talking about today?
Yeah, I already mentioned, but we can mention again. It's probably a good thing because some people are just tuning in. Aren't we talking about arthritic joints?
Yeah, so we're going to talk about many different joints and how you can help with arthritis pains you may be having.
Yeah, well, yeah, they are. It's out there, very common, particularly 50 and over crowd. But younger people get it as well.
I think we're not really talking about the spine too much in this one, though. But...
Well, yeah, we've got some in there though. We're going back with Bob and Brad on a little vintage history tour, some 3 exercises, and it does address the low back.
When we say vintage, we mean poor audio and video.
Quality. I guess there is a issue today with the Wi-Fi is a little, I don't know, the humidity or the heat is probably shaking.
I think our Wi-Fi is fine. Our iPad's just being weird.
I'm hoping. My singing. See, Karen says my singing is hilarious. So somebody
hilarious. She didn't say good. Notice hilarious.
Well, that's really not a bad thing though. Better than saying not so good. Anyways, yeah, very good. Wait, Utah.
We got Sue from NYC.
You know, sometimes I'm afraid I'm going to mispronounce the names.
Gina Marie Vandy is from London.
Oh, really? Excellent.
What time it is there?
Wow. Is there anybody hear my singing again out there or no? We're getting close to getting serious about doing our 20. We got 20 different tips on arthritic pain management to help you get through the day and actually enjoy your days.
The countdown's going to keep showing until the numbers are gone.
Yeah. So what did you do today, Mike?
I got ready to come here, and now I'm here listening to you sing and get ready for the wonderful people.
Your day is getting better all the time.
Bad hips in England. I wonder if they have bad hips other places too.
Well, yeah, that's you're going to get some good information.
Well, we
about
better
the
stop our
hips.
intro songs coming up.
Whoa, here we go. 5, 4, 3, 2, 1, and
Bob and Brad, the two most famous physical therapists on the internet.
Can you see better with those glasses on? Or?
hello. Yeah, I brought these glasses. What do you think of them?
Well, you have they cost $2 or they're plus 2.0. And I got a sticker on there.
That's so I can remember what they are, but they're my cheaters. So if I need them, I'll be putting them on. So let me know what you think. My wife picked them out. I thought she did an excellent job.
So we're going to go through 20 different recommendations to decrease pain from arthritis in your hip, your knee, your shoulder, and possibly other areas. But we want to say specifically it's osteoarthritis. We're not going to be talking about rheumatoid arthritis.
Right. They are different. You treat them different. So and most people, I'd say the majority of people that have arthritis as you age, it's typically osteo bones or the cartilage is wearing out from overuse, maybe genetic. There's a number of reasons. And if you want something specific, ask. We will not be able to get all the questions answered, but we'll give it a good try. We'll give it a go, as they say in England.
Yes.
Well, I think they say that.
Sure.
If anybody in England, let me know if that's accurate. I had a teacher that was from England, and he always said, let's give it a go.
Okay, well, let's give it a go and get going here.
Mm-hmm.
So some of the tips will be generic for all joints. Some of them will be more specific stretches and exercises. So just keep that in mind. So our first one is to actually keep moving, and exercising is beneficial for arthritis, but you want to make sure you're doing some type of low impact aerobic exercise. So what we mean by that is things like walking, cycling, swimming, anything in the water, like water aerobics is a good option as well.
Yeah, don't get scared when you hear the word aerobics. Some people think, oh, I'm not going to do that thing where you get your heart rate up, getting tired, sweaty, all that. We're talking like walking is a great way to get aerobic, or just moving and doing some stretches, which we will show some way to do this in bed before you get up, and you will not break a sweat, but you will get loosened up. Yeah. So low impact, low intensity. That's our first big tip. Motion is lotion. Did you ever hear that?
I have heard that. Yeah. And someone said I sound like Bert from Bert and Ernie. And the other guy's named Mike, and I've been here like a year and a half, 2 years. So you watch some new videos.
But oldies but goodies.
Too bad my mouth doesn't open like him. I could go this way then. It'd be kind of funny.
All right. Anyways, should we go on to number 2?
Number 2, well, technically it's 3 because our number system is all screwed up.
No, it's not. I moved number 1 down to number 5.
Strength training is actually something very beneficial. Now, with strength training, that doesn't mean you have to go bench press and squat and do all that stuff. We just mean some sort of resistance training. That can be body weight exercises. That can be bands. If you go to a gym and want to use weights, you can. But typically what they recommend for arthritis is going through the full range of motion that you have in your joint, but doing it nice, slow, and controlled, and also using a lighter weight and probably doing more repetitions because it won't be as much impact and stress on your joints.
I cannot emphasize lighter weights enough. As a matter of fact, you'll want them so light that you're not going to get your muscles to burn really hard like a younger aggressive weightlifter. You're going to just get them so they feel tired, the joints feel good. And if you're having a flare-up, can you grab me a dumbbell? I want to demonstrate this. This is really important. If you are having a flare-up, your joints are sore, and you still want to try your weights, what you're going to do is get a lighter weight than usual. And instead of, if this is your normal speed, you're going to slow it down and do slow motion. Just take your time. And if it hurts more when you get to the end, just do them in the middle of the range or the range that is more comfortable. And with time, maybe by the 9th and 10th one, you're already to the full range. So try that out. Slow, less weight to get through it if you're in a flare-up.
Girls can play too, said, should we wait until the swelling is down? This kind of depends upon what you are doing. If you're just going to go for a walk, that's fine. Sometimes movement can help. If it's a really bad flare-up and you're really sore, maybe try some ice if you're really swollen, or some other tips we're going to go over could be beneficial later as well.
Yeah, we'll go over some tricks on cold packs and what to use so it's not too aggressive. For example, if you're squats, hold on to something for your balance and control. And if you don't have to do these full deep squats. I know the knees over toes guy, endorses it. But if you got arthritis, your squats may be limited and only 20 to 30% of normal range, and go down and go back up when it starts to hurt or overdo it. Same thing as the same concept as I mentioned with this weight right here. So I'll keep my mouth quiet.
Do you want to go over some other exercises?
Well, we could go over some glute strengthening because it's a large muscle. And with that, we can get the hips loosened up, as well as some motion in the low back. Go ahead.
So most people with arthritis are not going to like to get on their hands and knees. So we'll just show a standing variation. You can go up to a countertop or something higher up, maybe a kitchen table. You can use forearms or hands, and you're just going to do some glute pumps. So you can just do little oscillating movements like this. You don't have to go through the full range of motion unless it feels really good. If you're not noticing your glute engaging that much, meaning your buttock muscle, you can try turning your foot in like this, and then we'll hit the glute max a little bit more. This is just a good motion to start in the morning to get limbered up. If your back hurts like this, try to have as good of posture as you can with it and just do more upright then.
All right. Rosa, you had some shoulder and arm arthritic pain. We're going to go through some exercises of that in a little bit. So just hold on to that, and we will cover some nice range of motion you can do to keep those joints in the upper extremity moving. All right. The one thing I do want to mention actually, right now, watch this, seeing how she asked, you're going to
watch this.
Well, I didn't realize. I thought it was like on number 8 or something.
No, it's right now.
Right. Shoulder circles. Come on, do them with me.
Oh, we're doing shoulder circles?
Yep. Imagine, I always tell my patients, think there's a piece of chalk on your shoulder and you're going to make circles on a chalkboard. People don't know what chalkboards are anymore, but the older people do. And go both directions. And that's a good way to start shoulder motion, because sometimes up like this hurts. So we'll work that a little bit. Use one hand if one shoulder's sore. Use the good hand to raise it up slowly, not too far, no sharp pain, gentle repetition. There's some exercise for the rotator cuff with these bands. You can just simply take the band like this and work that rotator cuff. Typically, out is better or is
W.
more beneficial. The W?
You are making a W.
Yeah. Well, not quite. This is the W. Then it hits you in the eyeball, which is okay as
it's a lower waist W.
Yeah.
Look at my W.
Right. So notice my elbows glued to the side, and I pull out and let it go back in. I can feel the rotator cuff muscles specifically working right there, pulls the head of the humerus back in, because sometimes the head of the humerus goes anterior forward, which makes arthritic pain worse because it's not sitting in where it needs to be in the cup.
I just want to mention, if you're watching the live, you can always rewind something if you missed it, or come back to where we are currently. Just scroll on the bottom tab there on Facebook or YouTube. Another tip for if you have hand arthritis more and you want to strengthen your grip, which is not too challenging, is to get some sort of squishy ball or stress ball. They do have different intensities of these, but this is a dollar store toy Brad bought. But you can just work on squishing that to get your hands moving. That gentle motion is pretty good for arthritic fingers. If you're really struggling and you can't even make a fist with your hand anymore, and your other hand is okay or can help, then you can try doing that and just using your other hand to work on making a fist, and then work on straightening it out as well.
Tink, can you go down a sec, Danny?
We are in the bottom.
Right there. Tink, Val. We're going to show you some exercises coming up here for your situation that you can do in bed. Bob and I, when we go back in time, will cover some things I think that you'll find beneficial. And the wrists. I've got early arthritis in my hand, and if I work this, just a simple exercise like this, and do wrist circles, palms together, and like this, keep things stretching. These are things you can do throughout the day while you're watching TV. Don't do them while you're driving, if you're in a passenger seat. What
if they have a Tesla?
Well, I would still not recommend it. I don't trust them things yet. All right. So we work the shoulders, elbows, and then the hands like that. We covered some of the good ones there. What are we talking about now?
I think we're going to go to stretching and flexibility exercises for arthritis. And this is the one where we want to bring Bob into the picture.
Right. So here we've got 11 years ago, Bob and I decided we got to make a nice exercise in bed to get the hips, knees, and low back loosened up. If you have pain there, arthritic pain, do these actually before you get out of bed. So these stretches, any therapist is going to say, yes, they're good basic stretches that will last. Good stretches, the test of time, and they're going to continue on. Danny, are we ready?
How many times we say good stretches?
We got a 3-minute video, and the audio is not the best because this was back in the day when we didn't have good speakers. All right, let's go with it.
I think it's microphones. Anyway, let's go.
So anyway, you try these and see if they give you any help.
Right. All right. If they help, they help. If they hurt, you don't do them.
Good time to do them is right away in the morning when you wake up, because the back is often very stiff in the morning, and this is a good way to wake it up. So.
Okay.
Oh, can you throw me a pillow, Brad? Do we have a pillow?
Not for you, Bob. We don't have.
We don't. Maybe I'll just use the Packer ball.
Yeah. Oh, there you go.
All right. Let's start with this. We're going to start, this is just a general one. This is a great one for anybody with back pain. I can't hardly think of anybody that can't do this one. You start laying down flat, you bring your knees up, and you're just going to gently start rocking. I said racking.
Yeah.
Rocking your knees back and forth. And what this is doing is it's opening all the joints of the back and closing them at the same time, bringing nutrition in, Brad, bringing in blood flow. And after a while, you can actually go a little further, can't you, Brad?
All right. Now let's go through a little details with this. You're going to have your knees together, but not real tight, gently together. And then when you go, look at his hip is coming over, but his shoulder over here is staying down. So that puts a little rotation throughout the spine, a gentle stretch, gentle rotation.
This, by the way, is actually not bad for an arthritic hip either.
Sure.
Because it gets that moving too. So you're getting to it with one here.
We're looking for a gentle range of motion.
And you can even let it stretch all the way at the end.
You bet.
All right. That's number one. Number two.
How many of those, Bob? 10, 20?
You can do 20, 30.
Yeah.
I mean, you can do it for 5 minutes to
Sure.
really loosen things up. I wouldn't start off with 5 minutes, but I'd start off with maybe a minute or two.
Right, and it should be pain-free.
Yeah. The second one is you're going to start off with you're going to go one knee to chest like this. And that's, again, starting to open the facets on this side, the joints on this side. I would go ahead and just give a little rocking motion like this, Brad.
Sure. If you've had a hip replacement, avoid doing it.
Yeah, exactly.
Unless the doctor says you're clear to flex that.
You're going to double benefit from this. This is a good stretch for the hip, arthritic hip at the same time.
Sure.
So you're going to do both sides. Again, stretching the back a little bit, stretching the hip. And then when you're able, you're going to go ahead and actually bring both of them up and do a little pumping like this. And it's going to help open the back and the joints and get a little nutrition in there.
Right.
That's it, Brad. 3 simple ones.
So, rotation, single knee,
And
double
double
knee, 20 repetitions, maybe more, should be pain-free. And tell this to your parents if you're 40 or 50, because they're probably in their 70s and 80s, and have them subscribe to us, because they're not too old to get on YouTube and do some self-help.
It's a great one to do in the morning, again, or, right before you go to bed, too.
Here, let me have that ball, Bob. All right, take care.
Rod.
You know, I'm really glad Bob punched that Packer ball. I would have done the same thing.
Yeah, I thought you were going to mention that. I don't even want to mention anything about the Vikings. But anyways, that outro, did you think that music was very nice and vintage?
We need a piano player here.
Now, what we would like to carry on from the exercises done in bed, we're going to go, if you want to do the same or similar exercises, weight bearing or standing. Mike's going to do them up using the steps. I'm going to do it using a chair or a stool, and it's the same motion with the hip and the knee and the stretch, but we're doing weight bearing standing, so it's a little more aggressive. Some people may find this better for them.
Now, depending upon your flexibility, you can put your foot on the bottom step, the middle step, or the upper step, and all you're going to do is bring one foot back, one foot forward, and then you're just going to lean forward as far as comfortable. Try to keep a nice upright posture with your trunk and back. And then when you're here, you can either hold it for time, like 20 to 30 seconds, and kind of noodle your leg around in and out like this, or you can just kind of repetition back and forth and see what feels good. This is going to work on bringing your knee to your chest and moving your hip as well. And then make sure to spend some time on the other leg Again, use handrails for support if you feel unsteady, but you don't need to if you have good balance. And just mess around with this. But Brad, they can also do it using a chair.
Right. Same thing. A chair with good solid armrest so you can balance is nice. Make sure you clean your shoes off or go with the socks. If you've noticed, I got nice socks on today. Get a close up of them, baby. Anyways, if you put your foot off the edge, that gets the ankle involved as well. I really like the noodling Mike talks about. I usually do mine on that wooden stool. Mike just moved out of the way. At home, I have a stool identical to that. It's a sister of that. And then, did you talk about going up this way too?
I did not. I just said keep good posture. You can talk about it more.
So if I go up this way, it gets
the back leg.
The back leg hip flexors, which are oftentimes neglected. That's a nice thing to do. So do these right now if you'd like. If you have a chair and you're going to be stable or a stairway, you will feel those muscles and joints. I do these regularly. It's one of those things I don't just do during my workout, but I'll do just standing around when I see a chair or some steps around. Even at the post office, I'll go up and start doing that before I mail my letter.
Now, some basic stretches you can do for your arms is simply circles like Brad had talked about earlier, or shrugging. If that seems kind of easy, you can do arm circles. I'm probably going to do them standing up. Obviously, if you're too arthritic, going big circles may be problematic. So you can just do little circles, or you can even bring your arms in and out like this. Just get some momentum behind them. Now, when it comes to the elbow, you're going to just work on bending and straightening what you can. If it's really painful, maybe use your other arm to assist with it and help it out until it loosens or limbers up. And then the wrists, you can just do circles like this. You can go clockwise, counterclockwise. You can also do flexion extension as well. So just getting some movement and light stretches going in the arms can be beneficial too.
I want to answer a question someone asked. I don't remember the name. It's scrolling. What about degenerative joint disease or degenerative arthritis? It's all the same thing in regards to the treatment or the exercises. You can do them. Don't be too aggressive. If they hurt, it's Margot. You do it, no sharp pain. Do them gently, do them progressively. And someone asked how many times a day you should do these. Once a day can be good, but once you learn your body, you may want to do them 2 or 3 times a day. And like I do with that stretch, I'll do it throughout the day whenever it's convenient, just to keep things moving. Motion is lotion.
Brenda said she has a hard time getting a good hip flexor stretch because she had knee surgery a little over a year ago.
Yes.
So doing what we just showed on the step is kind of beneficial because you're going to stretch the hip flexor on the one side and the knee on the other. And oftentimes if people are really tight yet, they feel better getting motion and not just moving their limb freely, but having it placed against an object somewhere and then moving your body into it. So the hip flexor, say my right side is tight, I will be getting a hip flexor stretch, and you can use your body weight momentum to kind of get there. So just try that out.
Yeah, and that particularly with knee replacement, depending on your mobility. But
she just had surgery. I don't know what she had.
Right. Well, whatever. Having 2 handrails is really nice to have so you can control your range of motion as well as your balance. Both are really important to have control over.
The next tip for arthritis is to actually work on your balance and stability, because the more you can control your joints, oftentimes the better they can feel.
Right. Now, when you're working your balance, make sure you're safe. We do have some really good videos on balance for seniors and over, 50 and over, and young people who want to really challenge. So Bob and Brad, best balance exercises. You'll see a big list of them.
You guessed it. She had a total knee. Sorry.
Oh, there you go. Tai Chi, did you mention that? Yoga, those classes are good to get into if that helps you, go in a group, so you have some social atmosphere and
just
whatnot.
Make sure you feel safe with what you're doing. If it seems too challenging, they offer a lot of variety of yoga classes. I interviewed someone about yoga over 50 on our podcast channel, and I've also interviewed someone on Tai Chi named Susan Thompson, who was a OTR one time in her life. Occupational therapist.
There you go.
But she talks about the benefits of Tai Chi as well. So.
Right. And so we've got podcasts. If you go to Bob and Brad podcast and type in balance and what was her name again?
Susan Thompson.
Susan Thompson. You'll get a really good education there. Someone asked about, I believe it was she, 50% weight bearing. and I don't know if it's as a result of surgery or whatever, a really good way to exercise that joint, if it's in the hips or down, is water exercise. I realize that's not convenient or possible for some people. If it is, that works really well. Otherwise, you
want to make sure your incisions are healed up before you go in a pool too.
Yeah,
if
get
you had
your
surgery.
okay from the doctor if you've had a surgery.
Surgery from a broken ankle.
But if you're 50% weight bearing and I'm going to exercise this knee or hip, right now, most of my weight's on this leg. Okay, I can either use a cane or armrest and maintain the weight through the other appendages and just work that gently. This is just an option. If you're really lost on that, because I'm not sure what your situation is.
She says she has surgery on a broken ankle.
A broken ankle. Yeah, that's
Liz.
interesting. What?
Liz is her name.
Liz
Dill.
Oh, yes. Liz Dill. Very good. Actually, you could just work it like this and use the weight of your leg, because that would be less than 50% of your body weight.
If you're non-weight bearing, just working on your ankle motion in and out, up and down, as long as you're allowed, that can be beneficial. And then maybe seated, because you're not putting full weight through it either. Just rocking up and down on your toes.
Sure.
Or doing in and outs or moving it with your hand. As long as you're allowed to range your ankle. We don't know your specifics from your surgeon. But.
Usually, if you're getting pain, you're going too much. Sharp pain for sure. So be careful. Take your time with that. We do not want you to take a lot of it backwards.
Your motion may come back, but it may not get full depending upon if you have hardware in your ankle permanently too. So just keep that in mind. Next tip is for walking.
Whoa, yes, walking. Now, this is one of the things that would apply to Liz for 50% weight bearing.
Well, yeah, she probably has crutches or a walker. Yeah, I'm assuming.
We lost our crutches.
Well, there's some sticks right there,
well,
so use those instead.
Yeah, if you want to use these to decrease your weight bearing, you got the wrong tool. These don't reduce your weight bearing. They do help balance really well.
But we're saying if you have arthritis, simply using an assistive device can help, because it takes load off of your arthritic joint, whatever that may be, and it can help. So obviously a cane would be, walking sticks, and it could be level 1.
Yeah, walking sticks are, good for
trekking
stability.
Poles, whatever you want to call them.
They're going to keep you stable, feeling more comfortable. Oh, Danny saves the day with
you can take crutches. A little bit of pressure off there. Obviously, if you have crutches, which is, depending upon your age and if you feel comfortable with them, and your shoulder health can be an option temporarily, at least.
So, Liz, if you have these or want to get those and you're not sure how to use them, make sure you watch our video and do it. But you don't let these pads go into your armpits for weight bearing. You're going to take it through your hands. There's a gap there all the time, because you can really irritate your shoulders if you do that too.
She's using a walker and crutches.
So she's probably had this education at the therapist.
Yeah, I think she does already.
Yeah. All right. Sorry.
Anyway, if you just have arthritis and it's getting more painful to walk, a cane would be the next step. So say if you have a left arthritis in your hip or knee or ankle or whatever, you're going to go the opposite side. So your right hand, and vice versa. If your right side is more problematic, use your left hand. If both sides are problematic, then it's probably time to try a walker of sorts.
There you go.
So you can use one with 4 wheels or 2 wheels, whatever you feel comfortable, but you can get a lot more weight off of your legs and still be walking, so you don't have to be homebound.
And we want to emphasize, if your pain kind of comes and goes, and you don't want to use a cane or a walker because you think that's the next step down. The goal is to use it temporarily, take the weight off of the joint partially, allow it to heal up and settle down a little bit, and then you don't have to use it again. And the more you work with that, hopefully the less you need to use the assistive device.
Mark has a question which we can talk about, I guess. Were we going to talk about walking mechanics in this video?
Well, we can a little bit. Does it seem like we wanted to answer it?
Yeah, Mark says, what about using your glutes for walking?
Oh.
And he says bum muscles and walking seems to help the knees. Yes, it does, because most people don't walk correctly nowadays with modern footwear. So what he's talking about is when you walk, a lot of people, when they have their shoes on, they put their foot way out in front of them. So you're getting, I'm going to pull that thing off there. They can't even see my feet right now. There we go. So once they put their foot forward, you're going to get a lot more impact forces in all your joints. So it's going to go ankle, knee, hip, back. So what you do is just walk with a soft bent knee, land with a bent knee, and then you're going to start engaging your muscles more, including your glute max or bum, as he was saying. And this is going to put the stress through your muscles where it should be instead of on your joints. So if you have arthritis, just try walking inside first in your slippers, barefoot, or in socks, as long as you feel comfortable, and try just landing with a soft bent knee. You're not going to take as big of steps, but you're going to start walking properly. And over time, it'll become second nature and it'll just start to feel better. Did I forget anything?
No, that was a good explanation, Mike. This whole thing about, I always used to think if I want to walk faster, I go out like this farther, which actually puts more pressure, impact pressure through the joints. So again, shorter stride, land on your forefoot. If you have joint pain and you walk like most people do, and then you try what Mike did, I think you'll feel the pain go down every time your foot hits compared to the heel strike.
If you're really struggling, I would suggest walk in place first. Most people don't heel strike in place. This is quite awkward. So you're going to just naturally step and then just start walking like that. And that's how you do it. Pretty simple.
There you go. That was in one of our later things, but we don't have to repeat it. Maybe we will then. Should we talk about
when to use heat and when to use cold for arthritis?
Heat and cold. You know, what do you have to say, Mike?
If you are very achy and everything feels tight, then heat could be a good option, because sometimes with arthritis, the muscles around it start to get tight and tense up to guard against your pain. So if that feels like you, using heat can be very beneficial. Now, if you are inflamed or swollen or have a flare up like our lady asked earlier, then ice would be very beneficial to try to help with that pain you're feeling or inflammation in the joint. Most people can kind of tell if they're inflamed or if it's just muscular tightness. So for heating, you can use anything like hot water, hot shower, hot bath. You can do electric heating pads, or you can do far infrared heat, whatever you have available. Some people like sauna. You could use sauna, I guess. Anything just to warm up the area can be very beneficial. Do you want to explain what the difference between normal heating pads?
Let's go through that. So if a regular heating pad, make sure whether you want heat or cold, you use whatever makes your joint feel better. I had a woman, she was in her 70s. She loved cold packs on her really bad arthritic knee. Most people, in my experience over 25 years, usually like warmth on arthritis, but not always. But get a pack that is soft when it's cold so that it wraps around the joint, because you want that contact. Don't put it directly on your skin. I would pull this down and put it on there. If you don't have a lot of money or you don't have one and you want to make one for cheap, that works very well. Rubbing alcohol and water and a Ziploc bag. And if you go Bob and Brad, how to make a cold pack, we show you exactly how to do it. They work very well. Just keep them in your freezer like that one. What happened to my sock? Oh, here it is.
Hiding.
This is a really nice hot pack. They don't work as well as the other ones, but they're pretty good. You take a sock. I have my sock. It's a gargoyle sock. I think it's better that way. Anyways,
gargoyle.
You put rice in it. Tie a knot on it. Make sure you wash it before you use it. And that wraps around really nice. It goes well around your neck.
Dry, uncooked rice to specify.
Yeah. And if you want to heat it up, you put it in the microwave, but not too long. You got to be careful of that. Otherwise, throw it in the freezer inside a Ziploc bag. Pull it out. Nice, cheap way to do it. Now, you may have heard of far infrared. And the big difference between far infrared and a regular hot pack is they go much deeper into the tissues, over 2 inches, versus a regular hot pack goes about maybe 1/4 of an inch. So much deeper, but there's a cost involved. They do cost more, but they do go deeper, and you need to keep them on a little bit longer. This is Thermatex. That's the brand that we endorse. We've used them and they work very well. They're built very well. Now there's a 6-foot cord on that. It just unplugs if you want. The nice thing about this one is it can wrap around the knee, can work on the hip,
and it has
the
straps.
ankle. Oh, yes, and it has straps, which you can put it around your low back, and the straps go in front. They're all Velcro, or you can put it on your upper back. I'm not going to take the time to demonstrate it, but it is a nice, really nice product if you are interested in far infrared. Should we talk about, I just want to mention,
you go ahead,
regular hot packs. Now,
They work. They're going to get more muscles than the joint itself heating up, but obviously they're less expensive because some people can't afford far infrared heat.
The far infrared, the nice thing about them is they only go at one temperature, and that temperature is between 109 and 116, which is a very good therapeutic warm temperature. These can have different low, medium, high. You don't want to get them too hot and fall asleep. These, oops, just my mic thing. The ones that we have, the Bob and Brad on, I'm not trying to sell them, but they are good, and they do have timers on them, so they turn off. Get a weighted one. Weighted hot packs, in my mind, are superior to the ones that aren't weighted because they wrap around, make contact, and it just feels comfortable. It's very calming and relaxing. So this one actually goes around if you have neck problems, arthritis in your neck and shoulders. As a cape form, it's weighted around the edge so it pulls down. These are both have cords on them. I don't have them on now. They just unplug, but it's easier to demonstrate. So those are some really good hints for hot packs so that you can go from the lowest level of cost to the weighted ones, which I think are superior, as well as the far infrared for those people.
Couple comments. Epsom salt baths helped me if I have pain. I've used Epsom salt baths too for recovery. They're quite nice, actually. It's pretty inexpensive too, and now they smell good if you want to buy a fragrance one.
Oh, really?
Yeah.
Oh, excellent.
I think I have lavender or something. Anyway, obviously taking the therapeuticness of the hot water is also beneficial. But yeah, some people swear by that. We also have a question about how about TENS units for arthritis on the wrist and shoulders? On the
wrist.
Oh, is that what they meant? Maybe.
I don't know.
It says REST, but maybe it is wrist.
Yeah.
TENS units, I don't see a lot of people with arthritis using them. They are a pain control option. They typically just work while it's on, not when it's off. But if you're having a really bad flare-up or you can't sleep, sometimes it can help people fall asleep. I've used TENS units before for like hip pain and stuff, but
you mean personally?
Yeah, personally. And it helped me fall asleep when I couldn't fall asleep instead of using anti-inflammatory medications. So.
Yeah, I think TENS are a good option. They're quite cheap now. You don't have, it's not like it used to be. There's some drawbacks. You have a battery pack, and they do make wireless ones now, but not so many.
As Brad says, sometimes use WD-40. They said castor oil rubbed into my pain helps.
Well, that is one of those. What do you call it? Old
wives' tales.
Yeah, whatever. But yeah, so I'm probably a little more positive on the TENS than Mike, although the hooking up and the wires and the things they have to stick to the
some of them are wireless
skin.
Now, but those cost more money.
Yeah, they still got to stick to your skin, and sometimes they fall off you. So there are limitations with it, but you go ahead and use them.
Yeah, you can try them out and just see if they help.
I'm glad that was brought up because it wasn't on the list.
The next tip we have is trying topical pain relievers. Now, there's a bunch of different ones. There's lots of creams, NSAIDs, or methanol. There's different active ingredients in them. So just check them out. There's lots of different brands at stores nowadays. They're relatively inexpensive. Just make sure you don't have any allergies to anything in there. Obviously, you would know if you do, but that can work. Just be careful if you have it on to not go in like really hot water or something afterwards, because it can really intensify the feeling you're having with it. And also, if you don't want it on your hands and you're putting it on somewhere and it's not one of those rub-on sticks, make sure to wear gloves, because otherwise it's going to be on your hands and that feels funny.
Especially if you rub your eyes afterwards.
Yeah.
That could be a big problem.
If you do have a topical cream, just make sure to be careful.
There's a lot of over-the-counter ones. We're not going to get into that. But yeah, go ahead. You can ask your pharmacist what the pros and cons are in regards to the ingredients. They're the experts at that. And I highly recommend if you got a good pharmacist, you pick their brains. They're very smart people. Oh, massage gun. Someone, what was his name again? I lost it, but he's asking about using a massage gun on the muscles above and below the knee. We're going to demonstrate that coming up. So yes, massage guns can be really helpful with arthritic knees, particularly if the muscles get tight around that arthritic joint. It's not for everyone. Some people will like it, others may not, but we'll show you the proper way to do it, because if you do it improperly, you'll be unhappy.
Some other options, obviously, is taking medications. You don't want to be on medications long term if avoidable, because they can have negative effects over time. So obviously clear this with your doctor. But if you're having an acute flare-up, it's pretty bad, you can't sleep, maybe just some light non-steroidal anti-inflammatories can help, like ibuprofen, Tylenol, whatever you take. Could be beneficial just temporarily if you're really having a bad flare-up.
Ashley, you're a martial artist and you have some hip pain. The doctor's concerned a little bit about it, saying, maybe a hip replacement in the next 5 to 10 years. Well, I was in martial arts for 17 years of my life, got my 2nd degree black belt, so I'm very familiar with everything that, I'm not sure what discipline you're in, but all the stretching, do everything you can that does not irritate your hip. If you do something and it gives you a sharp pain in your hip, do not do it, or don't kick so high if the high kicks irritate it. Continue to do things that do not irritate it. A little bit, if you're pushing the border, is okay. Repetition, if 10 kicks in a row feel okay, but 20 starts to hurt, back off, stay with 10. So good judgment, and actually the movement can actually help the arthritis if you don't overdo it and you do not do the volume too much. So good judgment and be careful.
We had someone say, I take magnesium lotion and it's wonderful.
Ooh,
and another person, Roseanne, says, check topicals. If you're on blood thinner, you can't use some topicals. So yes, if you're on any medications that might contradict the topicals, obviously check that out first.
Call your doctor and make sure that's clear.
Now the next tip probably seems like something we would say is maybe consider seeing a physical therapist in your area, because they can specifically tailor something to your arthritic issues or help you out. Whether that's, I can't move as well, I have limited motion, I just ache with everything I do. Maybe you're unsure if you need an assistive device, like to go to a walker or cane. They can just assess you, see what issues you have, and give you a specific program just for you, something you can keep doing then when you're done to try to keep your arthritic pain at bay.
Right. 1 or 2 visits is probably all you'll need to give you some guidance to get you going down the right path.
Next is modify your daily activities to make them more joint friendly. So if you're, say, on your hands and knees a lot, just having some sort of cushion underneath it instead of the firm hard ground can help. They have kneeling knee pads nowadays. You can get I'm just going to grab a foam pad here quick. Don't mind me.
There you go.
If you have some type of foam pad or even a pillow at your house, so you have to get down to do something, just use something softer so it's not as much force on your joints. Or you're talking about bracing there.
Right. This is the biggest problem I have in my hands is this joint right here, right by the wrist. It's actually part of the thumb. And when I bench press, it really irritates it. I'm going to have to change my weightlifting exercises. But I do better with this thumb brace. It offers not a lot of support. I still have functional range of motion, but if you get a brace, one of these generic braces, I recommend that one that stretches. It's elastic, has elastic properties, and it has Velcro. So you can vary, oops, I got this inside out. You can vary the
tension
support. So on this one, I can go to here. If I don't need support, I go like this. If I need support, I stretch it, wrap it around to the Velcro on this side. Now it's snug, supports that joint. It feels good right now, actually, just from being supportive. So you don't have to get a fancy custom brace. Oftentimes, elastic, the stretch.
Elastic.
With Velcro. That's what I meant.
Oh, well, I don't know what you're talking about.
I'm getting nervous in front of the camera.
I was reading questions. Ashley said she's going for her 2nd degree black belt in karate.
Oh, most excellent. Good luck with that. Excellent job.
And she said she's modified her training a lot from the pain.
Good. Yeah. I figured she probably, martial artists usually are very in tune with their bodies because of the training.
I think we can skip the walking footwear one because we kind of talked about that earlier. So let's get into.
We didn't talk about the wide forefoot, I think, is critical.
Oh, the shoes?
Yes, the footwear. If you've got arthritis in your joints, particularly hips, knees, ankles, and of course feet, 4 feet, it's critical that you wear footwear that has a wide forefoot. Mike is getting an example. Most footwear gets narrow and pointy up by the shoes. It compresses all these joints in your forefoot, and that has other problems as well, decrease in circulation in the hind vertebrae by the ankle as a result of some of the muscles that come back from the forefoot. I'm not going to get into that, but the big thing is make sure you wear wide shoes, so that, especially if you have wide feet like I do, that is really a problem. So Mike, go ahead and show.
I would mention, if you do have some type of severe foot deformity due to whatever reason, that check with your podiatrist, because some of these shoes might not work for you initially. But anyway, I digress there. So we have a wide toe box shoe here, and we have a standard shoe here. You can see at the toes, this black shoe here is much pointier compared to the other one. So that means it's a nice wide toe box. Most of them, if you just look up zero drop shoes, there's tons of brands. Most of them are fine. If you zero drop just means the amount of height off the ground the front of the shoe is compared to the heel. So if you look at this shoe, the heel is, well, I got black on black there. The heel is very built up compared to the forefoot. So you're actually going to shorten your calves and put more tension there. Where this shoe is the same height off the ground for the whole length of the shoe. This is a minimalist one, so it's very lack of cushioning. You don't have to buy a minimalist one. These are zero drop shoes, and they have plenty of cushioning. These are my old running shoes. So you could still get cushioning and still be zero drop.
I just on a girls can play, asking about the wrist, the side of the wrist. So I don't know if you mean the medial, the inside by the thumb, or by the ulna. But if you need a wrist joint, there's a lot of good ones over the counter. Again, same rules, elastic, the elastic with Velcro. And also with the wrist, they'll have what they call a stay. Is that right? The metal or plastic support that braces the wrist. You're welcome. A lot of times you get one of those and you can take it out if you don't want it, slide it in, gives more support to the wrist depending on your level of pain in the wrist.
Some people also just like to sleep with the wrist splint and not wear it during the day, because oftentimes they sleep like this and their wrist will get out bent. So that's also an option if you don't want to wear it all day. And
that can help carpal tunnel out quite a bit, actually.
Our next tip is to try aquatic therapy, which we talked about earlier. So oftentimes in the clinic, when I've seen people with pretty severe arthritis, we just do pool therapy. Obviously, you normally want a heated pool if you're actually doing it therapeutically. So if your local whatever gym has one, or physical therapy place, the heated pool is often better. And most of the time, you can just do whatever exercises you do on land in the water, and it just feels a lot better, because obviously you have the buoyancy and then you have the warm water, and most people feel great afterwards.
Right. Yeah, I cannot say enough. I personally, if you like water and you feel comfortable in it, boy, and you have arthritis, try and find a pool where you can go in and exercise 3 to 4 days a week. It's just one of those things is kind of a natural balm to the body, I think. And psychologically, it's great. If you don't like water and you're uncomfortable, that's probably not an option.
Aerobic classes are fine too. Just make sure you find one that fits your needs. Oftentimes they will say, if it's lower intensity or higher intensity. So just go to one that makes sense for you.
There you go. I know my wife goes to one of these.
Some of them look pretty advanced.
Classes. Yeah, and it's like, I don't want to even go there.
They're doing like jumping jacks and running in the water. It's not easy.
Wiggling those big ropes around. And,
go to a low impact one.
Backward flips and everything else.
The next tip seems probably pretty obvious to most people, but it's obviously just reducing your weight. If you happen to be overweight, it can take a lot of stress off of your joints. This is primarily talking about the legs. So if you're having a lot of hip, knee, ankle arthritis, the less weight you're carrying around, the less forces you're going to have on your joints.
Right. And, thinking about that, if you go back to the walking, just change your walking. You don't have to lose any weight. Just change your walking to the forefoot versus the heel strike. You should notice it that way, and then you don't have to lose weight.
CC asked if ankles and feet have been covered. It's been randomly talked about numerous times throughout the video, so you could scroll around CC and watch what we talked about earlier, but we're just kind of doing a lot of generic tips right now.
Yeah, if you have a specific question about ankle or feet thing, would be happy to answer that.
We just talked about footwear a minute ago.
We didn't talk about. Oh, I thought we were almost done.
We are almost done.
We got to do the hydration.
Whoa, that's part of it. The
Okay.
next tip is obviously getting adequate sleep, because if you do not sleep as well, everything, if you're tired, it seems more problematic or more challenging, whatever it may be. So oftentimes if you have pain and then you get a lack of sleep, it just feels 10 times worse because now you're tired and you hurt.
There you go. And we should talk about, sometimes you'll have sleeping positions that literally irritate the joint. And we're going to show you just a couple examples using a few extra pillows. Go around the house, grab some pillows up, whatever it takes. Go to the neighbors, ask them you can borrow some. And then Mike
I don't know if I want
to
to borrow my neighbor's pillows, but I guess you can if you want.
Well, my neighbors are very hygienic. I have trusted very well.
So if you're having some back pain and you can't sleep, sometimes some people feel better bringing their knees up to their chest and they get back pain relief. So if that's the case for you, you can try putting some pillows underneath your legs like this. Oftentimes you could try one pillow, two pillow. You could try the long way like this, or you could try going the shorter way like this, whatever feels comfortable for you and allows you to sleep if you happen to be a back sleeper. If you find this beneficial, something like a leg wedge could be a more permanent solution if you do this all the time. They're relatively inexpensive. There's tons of them online nowadays. Just make sure you look for a leg wedge, not the upper body, more triangle shaped wedge.
Right. It has to look like one of these obtuse triangles or whatever it is. They do, if you're a tall person, this distance from here to here, see how Mike's legs are hanging down? If you're really tall like Bob, his legs would be out here. So they do make different dimensions. So you have to kind of look at that so you're get something that fits your body.
Now, if you're having some type of hip or knee pain, depending upon the side, oftentimes we say don't lay on that side if you can. Some people realize cannot. But for the sake of this video right now, we're going to say I have a painful hip or knee on my right side, laying on my left side, and I'm going to put a pillow in between my knee. This can also help with back pain because a lot of people, if they're side sleepers, will end up rotating like this, and you can see how much rotation now I have on my spine. I have more pressure on the outside of my hip. So just putting a pillow in between your knees. You could do a small throw pillow. You can do a longer pillow, then you get your knees and your ankles. They even make knee pillows that are smaller and don't get as warm that they sell online nowadays, which some people find beneficial. So you can try that. If you have to sleep on your painful side and say it's your hip, another option you can try to offload that hip is to put a pillow down by your ankles and then put another pillow just above kind of your pelvis region here. So this will kind of offload the lateral hip there. So sometimes people can sleep like that if you have to sleep on the painful side.
Yeah. And Sonia mentions, she says using a pillow has been very helpful. She puts it between her knees for pain relief.
Now, if it's shoulder pain, what you can try and do is put the pillow underneath the arm. I would again recommend making sure the painful side is up in the air. You can use one pillow, you can use two pillows, whatever you need to get it in a comfortable position. If you have to sleep on the painful side, you can try, what about my mic? A canal.
The Erie Canal?
It's just a canal,
okay.
But call it what you want.
So the idea is making a hollow spot there for your shoulder to fit in, so it takes pressure off that joint.
Yeah, and then obviously if you're laying more on it, it's going to hurt more than if you rotated slightly off of it. So you could try that if your shoulder has arthritis and you can't sleep well.
Yeah, pillows can really do wonders on taking stress off the body while you sleep on those painful, irritated joints. So give it a go and have a good try with that.
Another tip is trying possibly some supplements. A lot of people talk about glucosamine or chondroitin. Chondroitin, sorry.
I think that's how it's pronounced.
I don't know how you say it. Anyway, obviously talk to your doctor first. There's a lot of
my glasses.
I could read okay. I just can't talk well.
I'll give them back.
Oh, those are terrible. Jeez, that's blurry.
They're number twos.
Anyway, obviously we don't sell or work with supplement companies, but it's something a lot of people swear by when they try it that have arthritis, and there's lots of studies and research on it, and it's relatively low impact on your health otherwise. So.
Right. You make sure you do some research on it.
Pretty cheap too.
Yeah, that can be. The other thing is simply drink plenty of water. So when you get up in the morning, the first thing I recommend doing, well, use the restroom if you need to, but then go to the sink, get 2 glasses of water, drink them down, because you've been losing hydration throughout the night, just breathing right through your mouth or your nose. Get that going, and you'll be amazed. It'll wake you up. It gets things moving inside. It's a great way to start the day. And then, of course, up to 8 glasses of water per day. On these hot days like this, you're going to do more than that. Yeah.
Yeah. And obviously, looking at your diet, whatever that may be, typically a general rule is less processed foods and more whole foods, whatever that is, or tailors to your diet. But the more processed the foods, typically, the more inflammation they cause within your body, which is what arthritis is an inflammatory process within your joint. So sometimes people are like, I didn't do anything different yesterday, but then they realize they ate a pint of ice cream and they're like, oh,
yeah,
they don't think about that. So yeah, it's just something to look at.
You know, I'm not a nutritionist, but a lot of things I read and hear is particularly lots of things with processed sugar, which is in a lot of foods. So make sure you look at the label. What was it, like yogurt? Look at your yogurt, man. You can have 120 grams of sugar in there. It's like drinking a can of Pepsi when you have
120 grams. What type of yogurt you? It's just not ice cream. Is that what you bought?
Maybe it's milligrams. I don't know, but it's a lot of sugar and what you think is a healthy and sports drink. Sometimes they're loaded with sugar. So really pay attention to what you're eating. Get the sugars out.
We got a couple more tips to get through. We only got 10 minutes. Avoid fried foods.
Let's hurry up.
Yes, avoid fried foods. Anyway, next one is massaging the muscles around a painful joint. So
someone did ask about this.
This can be your knee, this could be your ankle, your hip, your shoulder, whatever. So obviously you look at the joint that is sore. Well, I think for demo purposes, a knee would be pretty easy to show here.
And that was the question that was asked by, I don't remember his name. Sorry about that.
So all you do is massage around it. You can use your hands. You can have a professional do a massage. You can use a foam roller if you're comfortable getting on the floor. Obviously, most people with arthritis probably aren't that comfortable using a foam roller, but using a massage gun is definitely an option you can try. So just make sure to do the muscle area around the joint. You're not going to go directly on a joint or in a joint. You can't really massage a joint. So you're just going to do the musculature around it. Obviously, if you're by a bony area, so I have my kneecap here, you're going to want a softer head, an air head like Brad is showing there. I have a soft foam head on here. You're not going to want any metal or pointy heads that are really aggressive around a joint. You can certainly use those in muscle knots if they're far enough away from the joint.
Yes. Yeah, you do not massage the bone. Make that very clear. So what you're going to do, the reason you do the muscles around a sore, inflamed joint is because the muscles are responding to the pain and they're doing that protective contraction. It's like a splinting mechanism that your body automatically does. And that actually can make the joint worse because it's pushing the joint together, get the muscles to relax, more blood flow, less stress on that painful joint. That's why we do the muscles around the joint. So quadriceps, hamstrings, calves, if you have knee pain, if it's on the ankle, you may work above the ankle, just on the posterior or the back side. I've worked the bottom of my feet with a massage gun. If you're not working close to a bone, they make a massage gun like this with this head, which actually you can turn it on and it will go hot, or it can go cold, whatever you want. Like right now I have it on cold. There's 2 settings. And that actually, it's amazing how good it feels and it actually works. I thought it's cold, but it's not going to stay cold. Your skin's going to warm it up. It doesn't. It works. Very nice. And you plug that in to recharge. It's got a battery in it. So this is actually our, what do we call this? A Pro or something like that?
The Pro models. Yeah. So all my Pro models have a hot and cold head.
So if you have shoulder arthritis, you're going to work the pec major here. You're not going to get into the armpit and the shoulder because you got nerve bundle in there called the brachial plexus, which could be irritated.
Some lymph nodes too.
Yeah. So yeah, stay away from lymph nodes, and it should feel good while you're doing it. If it doesn't now, there's one exception. If you get over a knot, because the muscle's so tight, it's a little painful at first, but after 10 or 15 seconds of massaging around the knot, it starts to feel better. Then you keep working it if it feels better. If it just irritates it and feels like you're making it worse and worse, you got to get away from it more, or just wait for it and use a hot pack or a cold pack.
Another option with any massage you're doing is to get movement with the massage. So work on contracting whatever that muscle group is and going the opposite way and getting a stretch.
Well, that's your
see
pec
how
muscle.
it feels.
I know that.
So I'm doing my pec right now, so that pretty much pushes or horizontally abducts. Inwards like adducts, inward like this, or you can go back to stretch it. So just kind of moving around through different motions, you may feel a different type of massage.
Yeah, so that's massage guns. They can be very helpful. If you happen to have one, I don't know if I would buy one just to try it, because you wouldn't know. It's nice to try one out.
Beth misses Bob. Bob's here. We'll show him in a second.
Oh, yeah. We want to get on to I want to talk about the modified tools, which I find really helpful.
I think that'd be good to talk about before we wrap this up. So modified tools means anything within your house or something you use quite frequently. Either have a bigger handle on it if it's something you grab, or if it's a doorknob, you can actually buy these external things you put on your doorknob to make them thicker. Obviously, if you have a round doorknob and it's hard for you to grab it, maybe switch to levers if that's an option you have available.
I thought you were going to say a round head. Your head's kind of round.
No, well, I hope it is. It's not square.
Anyways, here's some examples. These scissors, these are going to hurt if you got arthritic fingers. Now, these scissors are not much more cost, much larger area, fits in the thumb, much more comfortable. So make sure you get the ergonomically designed tools. And sometimes they say they are, but look at them and see to make sure they are. But that's typically the difference. Here is a adjustable wrench. Some people call it a crescent wrench. It's got a padded big gripper here that you use your hand versus this, which is steel and thin. Much nicer to use than this one. Another example, if you're gardening, here's a typical hand shears, or I don't know if they call them shears or not, but you can see what they are. Small, easy to grip for the healthy hand. Now, if you have arthritic fingers, this one is actually got what they call a dual action. It's wider, and when you squeeze it, it actually rolls around, and it allows you to use your wrist muscles more than your small finger muscles and finger joints. So it does cost more. Both my wife and I are very happy to use this versus this one. This one gets used. This one sits in the back on the shelf.
Now, something you may use every day that you don't think about are your utensils at home.
Yes.
So if you already have ones with thicker, larger handles, that's fine. If you don't want to buy all new silverware, sometimes you can just buy little adaptive foam online that you can just slide over the pieces you use most frequently. So then the handle will have a much larger circumference than close.
I had a piece of foam just like that at home. I couldn't find it for today. I looked all over and I couldn't order it in time because, it's going to take a couple days.
But some people, silverware just naturally has larger handles too. So you can look at that. Basically what we mean is the circumference of the handle is larger is what we mean, not literally a huge spoon.
What about, they're asking about Bob. We've got her.
We will. Do you have anything else you want to add before we show Bob?
No, Bob is a priority now.
Oh, Bob's a priority now. I see how it is.
That's right.
We're lunch meat.
No, chopped liver.
Chopped liver. There's Bob. Wave to the people, Bob. He's busy working from home with his director hat on. So everyone say hi to Bob.
Hello, Bob. Yeah, hello out there.
All right. Well, I think that's wrapping up our live for this week. We'll be back next week talking about sleeping tips. So some are just how to sleep better, and some will be positioning ideas.
We forgot to talk about injections because that can be a viable option. However, that's a really good question for a physician. We do have a video on some general outlooks of it, like cortisone,
hyaluronic acid.
Yeah, hyaluronic acid. They call some people.
Some people have pain management clinics now that actually do shots more frequently. They're a different one. I've actually been working with some patients that have had those, and they enjoy them. They find it beneficial. Like every couple of weeks, they'll do a little injection. So yeah, that's an option to talk about with your doctor if you don't want to go down the joint replacement realm.
Right. My mother had an injection in her knee and it worked very well for a number of years. Just one injection. So sometimes it works, sometimes it doesn't. So talk to the doctor.
Do you want to say your favorite last line or
which one is it?
The broken heart.
Oh, yes. I want to put my glasses on for that because I look a little more intelligent. Fake people out. So once again, you've had another episode. You've wasted a complete hour listening to Mike and I talk. Just kidding.
Hour 3.
Hour 3. Anyways, we can fix just about anything except for
a broken heart, but maybe this gardening shears with the ergonomic handle can help.
Yeah.
Open you up.
We'll give it a go.
Well, these are different.
Yeah, they really are.
Wow.
They look nice. Yeah. Tell them what kind they are.
Power Gear 2.
They're Fiskars. Fiskars.
Oh, Fiskars. Oh,
You
sorry.
can't
That was
go
the
wrong
model.
with Fiskars. I'm telling you, I got a pair of shears by them. I can cut down a 2-inch branch off of a
Now they're
tree with my Fiskars, and I go like that. It makes you feel
Now they're
strong like bull.
Wasting more
Have
time.
a good day. We got to get off. We're done.